Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Often for infertility, the treatment intrauterine insemination or IUI can be suggested. It is also called as artificial insemination. So when you fail to achieve pregnancy normally, we recommend the after ovulation induction, which is giving you medications for growth of eggs inside ovaries and having intercourse at the right time when the ovulation has occurred. It's called as ovulation induction plus timed intercourse treatment. When that does not work, we often recommend IUI as the first mode of treatment. Now, what is IUI? Like I said, it's an artificial insemination process. Your partner's sperms will be taken, processed, and they will be inseminated or put back into your wife's uterus. So, because the process happens outside the body, where the sperms in poor quality or morphologically poor or low motile or debris will be removed, and only good sperms, good motile sperms will be put back into your partner's uterus. But the criteria for an IUI to be success relies on three important factors. So the first one is, like I said, good sperm quality. What do I mean by quality? Not just the number and the shape, which is morphology. The motility has to be exceptionally good. Remember that sperms moving progressively, or those that are able to move from point A to point B, are the ones that can make this journey till the egg which is waiting in the tube. So it's very important, very critical for the sperms to be of good quality. Next is, the woman or the partner should be able to ovulate, isn't it? The eggs are made to grow inside the body, and when they are of the right size, the size of the follicle inside which the egg is growing is measured, and accordingly an injection is given to release the egg. This egg then gets released and comes and waits in the tube, and if sperms are available, there is a good chance of fertilization. But if the ovulation is not occurring, then IUI does not work well. So what is the second point? The second point is that the woman or the partner should be able to ovulate, or the egg should be able to be released from the ovaries. The third most important point for an IUI to be successful is patent tubes, that is, the fallopian tube should be open. If the fallopian tubes are closed, then the success of IUI is almost impossible. Especially if both tubes are closed, then IUI will not be successful, because tubes are very important for IUI to work. The egg, when it is ovulated, it comes and waits in the tube for sperms. If the sperms are not available, then or the sperms do not reach it, then fertilization does not occur, therefore pregnancy does not happen. So these are the three most important factors. Now let's look at the success rate of IUI. According to the latest report published by the Spanish centers in 2021, IUI has the following success rates. Women who are under 35 years old, the pregnancy rate is around 14.3%. Women who are 35 to 39 years old, the success rate is 13.1%. And women above 40, the pregnancy rate is 6.4%. So as you can see, the age of the woman is the most important criteria for success of IUI. But not just that, also the quality of sperms and the patency of the tubes, the quality of the endometrium, all these factors together play a very important role. But as you may have observed, the success rate of IUI still remains very less. Even if the woman is less than 35, she could be 25, she could be 29, the success rate has not crossed 15 to 20%. So this is the dilemma. But definitely when pregnancy is not achieved by trying naturally or by just taking medications, IUI is a good treatment option for achieving pregnancy. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.